Well, welcome everybody to this week's webinar. It's great to see everyone. Hope everybody's doing well and staying safe and doing all the proper things out there. I am Bruce Rosenblatt. I own Senior Housing Solutions, and if you don't know who I am a senior housing expert, and I own a company called Senior Housing Solutions, and we provide advice for people who are thinking and researching senior housing in the area. So I've been doing this for over 30 years. I have a lot of experience in senior housing, and I am very passionate about what I do. And so I help people through this entire process, help educate people about all the different options out there so you can make a well thought through decision. I also try to be a resource for people, and being a resource for people, comes in a lot of shapes and forms. And one of those is trying to share my resources with other people so they can become educated. I had the pleasure of meeting Sharon Bruno probably about a year and a half ago. We were on a panel discussion together, and I just really embraced what they do. And so it was sort of a natural to invite Sharon to be part of today's webinar. So Sharon, I know you're excited about being part of this. So Sharon, I'm going to turn everything over to you, and the show is yours.
Great, awesome. Well, good morning, everyone. Thank you, Bruce, for having me today. I'm very excited to be here. As you can tell, I'm keep on walking around pacing. But like you said, we met a year ago. It was a panel, and I'm so glad to have met you because I've been in this town since 2000, and I don't know a lot about the senior living communities. So knowing Bruce, I pretty much send everybody to him. And matter of fact, I start carrying his business cards. So if there are people that are asking questions or needs assistance, I pretty much tell them to call Bruce, and here's the business card. So he already helped a few of my friends and some people that I know or meet along the way. So this is a great partnership. So thank you for again for having me today. And yeah, I'm excited to share what we do at Longevity Solutions. So we'll start this presentation. Thank you everyone for joining us today. We appreciate your time. I'm Sharon Bruno. I'm a registered nurse and vice president at Longevity Solutions. I did more than 20 years of reactive care, from a unit secretary, med-surg nurse, step down ICU, nursing supervisor to a chief nursing officer. So pretty much I took care of all kinds of diseases. Pretty much you break and we try to fix you. My passion now is proactive, preventative approach to health and wellness. We will start this presentation with a short video.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So if you are a compliant patient and you see your primary care physician every year for what we call annual physical examination, for over 100 years, this is what we do. We do a physical exam, a basic labs. They will use the reflex hammer or the stethoscope. The physician is going to try to integrate that and tell you how healthy you are. This is what we used to do and what we do up to now. to measure our health. Did you know that the stethoscope was invented in 1816? All of these tools were invented in the 1800s. Did they use this when you went for your physical exam? Yes. This is what we use to measure our health up to now. With all of the technology that we have now, the smartphones and smart homes, self-driving cars, this guy is sending people to Mars, and we're using a stethoscope to your heart and lungs. This is the reason why we brought Longevity Solutions in Naples, Florida. It's proactive, preventative, and personalized. And the other reason why I do a lot of these presentations is because when we started here in January of 2019, we found out that 80%, of course, this is before COVID-19, 80% of our clients are from all over the country and the world, 20% of them from Naples, Florida. So we want everybody to know that we are right here, right in your backyard. If you are here in Naples or Southwest Florida, we're right here in your backyard, and we do all this and you have no clue about it. So this is part of the reason why I'm doing this presentation here today. So the 4 primary areas that we looked at is cancer detection, cardiovascular disease, metabolic disease, that includes the inflammations, diabetes, and neurodegenerative diseases, that includes the Alzheimer's disease. So how do we do that? We do a deep dive. What we do is a whole genome sequencing, and I will be explaining this process, whole genome sequencing, a full body and brain MRI, blood work that is more comprehensive than the basic blood work that you usually do in your annual examination, a CT calcium scoring, looking if there's any plaquing to the arteries that supply your heart, because the increase of plaquing causes that heart attack. And then, of course, medical history is very important. But again, to identify the disease early and actionable. So if we find it early treatment, and then a better outcome. So I'm going to give you some of the results, examples of the MRI that since we started doing this. So for the MRI imaging, here are some examples. These are husband and wife clients of ours that came from Miami. So the wife was so excited. The only other place that you could get this done is in San Diego, California, which is a partner of ours, the exact same thing that we do. So the wife was so excited because she was planning to go to San Diego to get this done. Now that we do it in Naples, it's like, oh, I'm going to drive 2 hours, Sharon. I'm going to see you. And my husband and I will be there. Well, the husband said, no, I'm not going. It's like, I have so much to do. They have so many businesses, right? Well, she finally got him to come. They came here February of 2019. With her results, nothing much going on, like very simple things needs fixing. With him, we found, if you could see here with a little arrow right there, there's a bladder cancer in stage 1. So this guy from Miami, so a urologist there, and not satisfied and got a second opinion, went to New York and saw another urologist. The only thing the urologist asked him, how did you find this? Because he had no symptoms. So he went for an outpatient procedure and took care of that. So they already sent their whole family through here and all of their friends. Saved his life. He's one of our biggest advocates out there. This gentleman right here, 63-year-old, again, no symptom. So he came to us. We found very tiny little thing there with the arrow, stage 1 lung cancer. So he is actually a surgeon from out of state. He went to Cleveland Clinic. Cleveland Clinic was asking him, how did you find this? Because the only time that he's going to find this is either he's short of breath or coughing up blood. By that time, it'll be stage 3 or stage 4. So he's never smoked, if you look in here, no family history of cancer. And we found a stage 1 lung cancer on him. Right now, he's 63 years old, right? He's about to retire. If we didn't find this for him, in 2 years, if he starts to have symptoms, then he's going to spend his retirement pretty much having chemo and radiation. So this surgeon, in 4 days after getting, what they did is they removed part of his lung and that tumor with no chemo and radiation. So he's back to work in 4 days. So he was so grateful and sent his whole family and all of his friends as well. This one is a younger female, 34 years old. She is a CFO of a company, and she said, "Oh, I'm healthy. I don't need that. I don't need to do that." So I think the company sent them through, and this is what we found: stage 1 thyroid cancer. So she had no idea she had that. The great thing is we found it so early that they only did a partial thyroidectomy on her instead of a full thyroidectomy. So because if you remove the entire thyroid, being 34, she's going to go to a menopause. So partial. So she's so grateful that she went through for this. So it could be for young or older individuals. Prostate cancer. So a lot of these men had normal PSA levels. Some of them had abnormal PSA levels, but the biopsies were negative. They went through and we found stage 1 prostate cancer. So it's good that we found just the very early stages of it. But they didn't even know. It's because you could do a biopsy, but you're doing a biopsy of the one side and not the other side where the cancer is. So this is the one that scares me the most, brain aneurysm. So if you look in here, there's a ballooning of the artery. I don't know if you guys could see that. That is not normal. So this is asymptomatic. Normally you don't know if you have brain aneurysm. The only time, I've seen this so many times when I was working at Physicians Regional in the ER. I was there for 12 years. So I float in the ER from time to time as a nursing supervisor. And I've seen this where the brain aneurysm ruptures on you. So it gives that massive stroke, or I've seen it, they drop dead. Again, it's asymptomatic, so they don't know that they have it. We have found this in some of our clients already, and they, depending on how severe it is, they could go for an outpatient procedure through their groin or through their head. It beats rupturing on you. So if you look on the data, even if they make it, 66% of the patients suffer from permanent neurologic deficit. So finding a brain aneurysm that's not ruptured is much more very early treatment for that. So what we found since we opened in January of 2019, like I said, nobody comes here with the symptoms. No one is in a wheelchair or a stretcher. They're all walking in here trying to get a baseline of their health. And a lot of them actually just got out of their primary physical examination, the annual physical examination. And some of them actually went to an executive health assessment in Mayo Clinic or Cleveland Clinic. So they were told they were healthy. Oh, you're good to go. We'll see you next year, right? So these are the ones that we found. So I already mentioned almost all of this. At the bottom, you would see advanced coronary disease. So this individual had normal cholesterol level every year. They came through here. We found blockage on the arteries that supply their heart. They had no idea about it. So we had them referred to a cardiologist. So again, we don't know what we don't know, right? We just don't have a good way of finding things until now with the health assessment that we do. But it's not always negative. Like my mom. So she has abnormal cholesterol level every year. So she had a medication. The physician said you have to take statin because of your total cholesterol is high, bad cholesterol is high. So she did it, she started it, and the side effects is so bad she had to stop it. She's doing fitness and nutrition right now. So you already know, I did the assessment myself. I put my whole family through and my mom through. Her CT calcium score or heart score is 0. 0 is the best score that you're gonna get. So what's the point of that? So that means my mom actually does not need the statin because she has no blockage to the arteries that supply her heart. So even if she has a high cholesterol level, that could be taken care of by fitness and nutrition, but the physician still has her a prescription for statin. So the stages of cancer, every client that's been through here When we find something, we find stage 0 or stage 1, which is again, early detection, right? But we all know somebody, a friend, a family member, a neighbor, right? They felt something. They went to the doctor or to the hospital. They found stage 3 or stage 4. The moment you have symptoms, it's late. Does not happen overnight. So the whole genome sequencing, this is always a mouthful. People always have a lot of questions about this because they don't understand it. So the whole genome sequencing, it's a blood work that we do, and we sequence the entire thing. So just an example, if you do like a recreational DNA sequencing, like I think 23andMe, Ancestry, all that, when they sequence your genome, they look at about 750,000 base pair DNAs. When we sequence it, we'll look at 3.2 billion base pairs DNAs. So it's the entire thing. So we're not missing anything. This is where you probably heard BRCA1, BRCA2. So all of those we see, and a lot more if you have any of those mutations, we'll be able to see. This is an example of another husband and wife. Husband doesn't want to come again. The wife wanted to do this. So husband said, I don't care. I'm very unhealthy. I don't want to know. I don't care. So the wife is really like pushing for this. So the only time they finally got through is it's the wife's birthday. They were actually here having the assessment on her birthday. So with him, like I mentioned, he's very unhealthy. So the physician was sitting down with him and explaining his results. He has pre-diabetes going on, and he's 43 years old. He has liver disease going on because he doesn't eat right and does not exercise. And to top it off, if you see the highlighted in yellow there, he has the genes for cardiomyopathy. That means he has the genes for heart failure. He obviously didn't know anything about that. So the physician told him, you're 43 right now. If you're lucky in your 50s, you're going to end up in the ER and buy yourself a defibrillator if you make it. So this guy, this about 6-7 months ago, he already lost 45 pounds. So the thing is, for some people, you need to get it validated. They got to show it to you. This is what's going on. So the wife is very happy. They have 2 little kids, 5 and 7 years old. So they're all eating better and living healthier right now. So I was very excited for her. So another part of the whole genome sequencing that we do is called pharmacogenomics. What that means is how your body is processing the medications. To me, this alone is priceless. So I never knew about this with 4 years of nursing, 20 plus years of experience. I learned about it when I started doing this in 2018. So this is my actual results. If you look in here, it's highlighted, Plavix. I found out Plavix will never work for me. Plavix is a medication usually given to patients when they had a heart attack. They go home on Plavix, right? Will never work for me. I never knew that. Coumadin, which is a blood thinner. I found out I'm highly sensitive, which means very small amount I will bleed out. Again, I never knew that. So when I saw this, I don't take any medications, but as a nurse, part of my job is to actually educate my patients what medications they're going home with, right? How many times a day to take, what's the dose, right? So I've sent so many patients on Plavix because I was at Physicians Regional 3rd floor heart center. 2 weeks later, those patients come back with another heart attack. Us, nurses and doctors, looking at them. What are you doing here? Are you not taking your medications? Why are you having another heart attack? And they're like terrified. I took it. You told me every day I took it. Now I realize that patient or individual is probably like me. Plavix doesn't work for them, but we give those medications to everybody, right? It's like the standard medication that those days when I was working. So Coumadin, how many patients went back to the ER bleeding out? We all know about this. And next thing we're doing in the ER, blood transfusion, colonoscopy, right? That's what we do. What if they are highly sensitive like me? So the point is, and there are other medications here. We'll look at about currently right now 90 medications. There's Zoloft, Valium, all of that. So Right now, if you are diabetic or has depression or high cholesterol, physician gives you medication. And then you go back to the physician like 3 months later, doc, I don't think this is working. Oh, it's not? Let's double the dose. I don't get it. So, but that's exactly what we do. This is the kind of nursing I used to do. So, but don't get me wrong, because we actually have patients in the past that they're lucky. We're able to pull all those tubes out and start to teach them how to swallow again, how to eat again, how to sit on the side of the bed again, and how to walk again. But why do we have to wait up to this point, right? If there's a way for us to find out if there's something going on now. And the other part that I've seen so many times is when we get sick, or our family member, we will spend everything we saved and work hard for to get better. That's what we do, right? So this is what I do now. Our clients come in. There's a 10-hour fasting. There's a consultation that we do. Want to make sure that they're okay to go through the MRI and all that, because there's like a safety questionnaire that we do. It's about a 4-hour assessment. It's all personalized. It's all scheduled. And our partner, which is Radiology Regional, we take them there in a private car when everything is set up. So it's all scheduled. So when we get the results, we don't spend a lot of time talking to you in the beginning. We take care of all the paperwork, do the assessment for that one day. All we need is 4 hours of your time. And then when we get the results, our physician will have 2 review of results with you. So depending on the results, that's when we're going to have, the lifestyle advice and all that referral if necessary or needed. So the Longevity Performance Center that we have, this is only in Naples, Florida. So a lot of people that been through here that's local, and they have all this information about themselves. So they ask, what do we do next? How do we take care of this pre-diabetes or this high cholesterol? So the Longevity Performance Center is our wellness center. So we have the nutritionists in there. We have smart machines that they could go through and get their kind of better lifestyle. So if you see in here, the great part about the center is we wear this band. You touch the machine, everybody's set up on it. You're set up on it when you're onboarding. It knows who you are and it knows your workout. So you don't need to keep changing all your seats and all that. It knows how much weight, how many repetitions, know exactly what you did yesterday or 2 days ago. So we have cardio machines. Strength training is so important because now there's so many data about strength training. So no guesswork about the weights and repetitions. And we have an app on our phone. So if you can't tell, that's actually my mom right there. So our app, it will tell us, I wasn't happy in the beginning because I never used weights before. It's always cardio. But when I started with the muscle age, I was 63 years old. So every 6 workouts, it will give you this strength test, and it will, most of the time, it will drop the age, the muscle biological age. So it's been a year and a half since I've been working out at our center. So I'm 21 now. My mom is 21 and Nertila in her 30s, one of our employees, she's also 21. So that's the biological muscle age. And Bob right here, our member since January 2019 as well. So he decreases biological age and everybody feels great. It's just, you feel all the strength. You could get off the floor easily. You could play with your kids or grandkids. It's just amazing. I mean, if you look at our website, you'll see all the testimonials of our members. So the other great part about I just loved our facilities, because both of our facilities has this Synexus system. This is even before COVID-19 or anything else. Our CEO is very into exponential technology and everything. So he met this owner of Synexus system. It essentially what it does, it's on our HVAC system for both of our facilities, and it helps with the viruses, bacteria, all of that. You don't smell it, you don't see it, but it pretty much bathes the air 24/7. So that we have so many people interested in asking about the Synexus system that we have, because it's so, so nice and it protects the facility and the building. So you could look it up, and like I said, there's so many people asking about this, and some of them, there's some portable equipment that they have, but ours is on the HVAC system, but it's amazing. Of course, we adhere to all the guidelines, but this is like an extra thing that we have in both of our facilities. So 80% of the chronic diseases are actually preventable with lifestyle. The high blood pressure, the high cholesterol, all that. A lot of people would tell me, like, they said, oh, you know, everybody in the family had heart disease, everybody in the family had diabetes. So I like asked them, like, so what do you, like, you're just gonna sit around and wait for it to happen? Because it actually doesn't happen that way. So you have to make the change on your lifestyle to be able to avoid all these conditions, even if it's in your genes. So if we find something in your genes, that's 25%. 75% is what you're doing. 50%, according to CDC, 50% of cancers are fully preventable by proper lifestyle. Again, and here's the other thing. So if you have osteoporosis, 10% in a year, you will increase the bone density by doing strength training, versus if you have osteoporosis and the doctor gave you a prescription medication, it's usually a shot, 2 to 3%. So why would we even do the medication if we could do the strength training and increase it 10%? So you would see this on a bone density study, or what we call DEXA. So this is very important to prevent, it prevents fractures. And here's the other one very important thing. So when you do exercises, strength training the most is the best for you. It will decrease your cognitive decline. So when I go to some of the places in town or communities in town, I would see individuals, older individuals, you know, doing crossword puzzles, Sudoku, all this stuff. I normally kind of want to meet with the activity director and ask them, like, do you have any exercises that you could prevent, or you could ask, you know, to put here instead of this? Because when you're exercising, you're increasing, or that it's called BDNF, brain protein derivative factor. That's the protein in your brain. We're doing exercises, it will activate it. So it will prevent you from having cognitive decline. And even if you have some of them, it will arrest it. But you gotta be able to move and exercise. It's not the crossword puzzles, it's gonna help. So our members that are compliant, okay, you have to be compliant. I have a lot of nurses and doctors that actually signed up, right? And I never see them. 2 weeks later, I text them, it's like, where are you? What's going on? I said, we make it smart, you know, you still need to show up. And there's like, I know. So our clients who've been showing up, in the first 6 months, because we do biomarkers, which is blood work, we have lowered their fasting blood sugar 13 points, their bad cholesterol 17 points, and 5% of their body fat. And we increase their muscle mass. We also have the in-body that we could measure all this, and they'll be able to see it. So increased strength and increasing your muscle mass will definitely make you really healthy. The other part that we have at our center is called laser therapy. So it helps with pain and inflammation. It's about 10 minutes every other day. And then the other one is the magna wave therapy, which is FDA approved to treat depression, anxiety, migraines, and a lot more. It's actually, we're so happy we got the magna wave therapy before the COVID. It was like mid-March when we got them, because it's so busy with that right now, because a lot of people want to get that, want to sit on that chair, and that's about 30 minutes. So depending on what membership you have, it's included with all this, or we have clients that are just coming for this. So it all depends, and we'll be happy to explain them all to you. So the choice is yours. Where do you want to be? In a nursing facility, waiting for your life to end, or you want to be healthy, chasing your next life's experience? When your health goes, it's game over. The healthcare of the 21st century is now here in Naples. Couple of things you may want to ask your doctor. It's all good to ask your doctor about what we do, but these are the 2 things that you may want to ask them. If they know the answer to these questions, great, because your doctors are, we're up there on the cutting edge of things, right? But if they don't, they may not know the other questions that we're going to ask them. And we'll be happy to talk to them if they want to know more about what we do, because we're always happy to explain, myself or our physicians, and kind of let them know. Our website will also show a lot of things. So you want to be a CEO of your own healthcare or outsource this to a uninformed third party? This is our team. So Longevity Solutions. Thank you.
Thanks, Sharon. It's excellent. I have some questions for you, and then I'm going to open up to the everybody else to see if they have some questions. So the first one is, I'm sure you get this asked a lot, but how much does it cost?
So the assessment that we do right now, currently it's $6,500 for the cutting edge assessment that we do. That includes the MRI, the CT, the blood work, and the whole genome sequencing. So you could, a lot of our members, they, you know, some people had asked me, say, do I need to do the assessment or can I go to the wellness center? So you could enter in both ways. You could enter at the Performance Center first, which our membership ranges from $129 a month to $149 a month, depending on what you're looking for. So if you need a nutritional support, that's the premium plan, and that's like $149 a month. But if you just need the use of the equipment, that's about $129 a month. So, I mean, great value on having the nutritional support, because fitness and nutrition always go together. But you could do that first, and then, or either way, you could enter either way.
And I'm assuming that's all private pay, that typically an insurance company or Medicare doesn't pick up any of that.
So our our healthcare with our preventative dollars is about, I think, 2 to 3%. The rest we spend on sick care. So unfortunately, this is not one of the ones that they would pay for. Number one reason is because I've done so many of this when I was doing the hospital setting. In order for them to pay for a, let's say, a CT or MRI or blood work even, right? They need to have that ICD code. They need for you to have a disease, right? For us to be able to, for them to pay for it. Well, like I said, all of my clients that been here have no condition. They have no disease. They're trying to get a baseline of their health.
And the price, it's less here than it was out in California. Is that correct?
Yes. So the same exact assessment in California is $7,500, and we do it currently $6,500. Yes.
And how often would somebody do this test? So, you know, if I went through this, I did a test now, would I do it 2 years from now or a year from now?
So we encourage it annually. So the annual exam, the annual the annual assessment, and then it becomes a, the initial assessment, and then it becomes an annually. We get the sequence of your genome, the updates, because there's new things happening, right? But we scan you for the MRI every year. Anything could happen in a year, but it's half the price. So it's not that full price that you paid for the initial one. So I actually had my follow-up already, and a few of our clients that went through in 2019, pretty much like January, February, March, all that.
And I'm sure you touched on this, but do you help people get healthy? You know, so they've gone through the analysis, and they maybe there's certain things that you've seen through through your analysis. Do you counsel people and refer them to other resources?
Absolutely. So our team, our clinical team, the physicians, nurses, nutritionists, we help them out. Actually, a lot, even not the local, not the Naples clients we have, remotely, we are doing nutritional support, or even giving them exercise support. You know, like our trainers would give them some of their exercises as well, so we could help them remotely if they don't have any. A lot of them have their own doctors, have their own personal trainers, you know, have all that, or nutritionists. But if they don't, yes, absolutely. And our physicians will direct them if there's something that's found. 14% of our clients, we found something, and of course everybody else was good. like myself, a clean bill of health is priceless. So at least we know now, like my mom as well. But yes, we do let them know what follow-up needs to be done and what specialists and all. So we definitely help them with that.
I think I already know this answer, but if you can just touch on the privacy aspect, is this information shared with insurance companies and with, or is it just between us?
So it obviously everything that we do is, it's HIPAA protected. We don't share anything with anybody. In fact, we have some patients or clients. I'm so used to like patients in the hospital setting. We have clients that would say, "Oh, can you send this to my doctor? This information here and there and all that." So I normally tell them, it's like, we give you all the results, all of them, but it's up to you who you want to share it with. So it doesn't get out of hand. So they could share it with their doctors or whoever they want to share it with.
And Sharon, if people wanted to reach you, what is your contact information?
So what happened to so that would be, I'm on this information right here. It's 239-238-1650 is where our center is. And then you could send an email to info@longevitypc.com, or my email is svbruno@longevitypc.com.
Well, thank you. I'm going to open this up. I'm sure people have some other questions. So try to touch. I think I went through my list. So.
Great questions. Thank you.
So everyone is unmuted. So if someone has a question, just speak up. Anyone?
Are there any health organizations, insurance organizations that are now working with you?
So we are trying to work with them, but the thing with this, like I said, it's I mean, it will be like a goal for us to be, because we want everybody to be able to go through this. Unfortunately, no one is working with us yet with this, because nobody has any diseases or conditions. If you're just trying to get a baseline of your health and trying to do an MRI, they're not gonna pay for it. So what happens is, when something is found, if there's a condition, let's say the clients that we had with the lung cancer, stage 1 lung cancer and all that time they are able to use their insurance company because there's that diagnosis. So, but doing the health assessment, unfortunately not. Oh, the other thing that you could use if you have HSA or FSA, that flexible savings account, and some people have used that if they have that. Other than that, unfortunately, not yet, or no. Not sure if it's going to happen. We're like fighting big insurance companies and
You
big
can use health savings account money for that.
So Sharon, because a lot of the people on this call are probably over 70 years old, and they may have certain things that are going on. How do you, does your analysis work the same for somebody who is a little bit older versus someone who is younger?
No, they're all the same. So our clients, we could 18 years old to 100 years old. I think the youngest we had is 18 and the oldest so far is 92, but it's all the same technology that we use. And it's funny because we actually had clients in the past, they had cancer and on remission, right? So let's say it's breast cancer. So obviously there's surveillance they're doing, with the breast cancer. They're doing a mammography every 6 months or every year, right? So this client came through, I think they were on remission for 5 or 6 years. They came through and we did the full body and brain MRI and all. We found something going on in their brain, very tiny, very early, but she has no symptoms. She has no cognitive decline. She has no confusion. She never even knew that she had that. So we found it early, they were able to fix it. But that's the thing, sometimes for people with had histories, it could be somewhere else. It's not just that one place. The two things we don't stop is obviously, I mean, we don't want you to stop anything with your physicians anyways, but mammography and colonoscopy are two different preparations. So we still continue. There's like a process of things and review of things that we go through our clients that are coming through, so they understand exactly how this goes. But just so everybody's aware, colonoscopy and mammography is very important and still needs to be done. But aside from that, we're able to see here your brain, memory center of your brain, your neck, thyroid, chest, lungs, bladder, pancreas. Oh, pancreas, pancreatic cancer is, I think, the deadliest cancer. You always like look at Steve Jobs or Patrick Swayze, right? It's always late for those. But we have seen some changes on their pancreas. It's not cancer, changes. So it's being surveyed by their doctor. They're doing some, make sure that it's not, the pancreatic cancer. But again, early finding is, to me, because since I've seen so many different kind of diseases, that's always late, because when they end up in the hospital setting, it's late. So I'm just very excited about this new proactive approach that we're doing.
Well, Sharon, great information, very interesting, very state of the art. I think you touched on something about, people spend a lot of money after they are not well versus trying to spend money or do things to get you, so you don't need.
Right, the quality and the quality of life as well, right? I mean, spend that time on chemo and radiation or being in the ICU or whatever else. It's just, I can't tell you enough. You don't want to be in that hospital bed.
So reach out, Sharon. Thank you very much for your time. Reach out to Sharon if you have any questions. I appreciate everybody being on this webinar. Next week, I'm excited, kind of going along with the same theme. We have Deb Logan she's the executive director from the Blue Zones. And so if you don't know about the Blue Zones, she's going to tell you about it, but she can also update you about what's going on in Southwest Florida about the Blue Zones, which is very exciting. I know Sharon is part of the Blue Zones. I was one of the first organizations to be certified through the Blue Zones, so I'm a firm believer of it. So that's next week, next Thursday. So everybody stay well. Reach out to me if you have any questions about senior housing. And it's great to be with everyone. And so stay healthy, everyone, and take care.
Thank
Thank
you.
you.
Thanks.
Thank you.
Thank you.